Hi, Ms. Johnson. I just wanted to go over some of the information that the doctor talked to you about today. They did find that you do have a diagnosis of Alzheimer's dementia, and I know that that's a hard diagnosis for you and also your family to take. The National Center for Biotechnology Information states that African Americans have a higher incidence and prevalence of Alzheimer's disease than whites. That was reported to be twice as high. It's still undetermined what actually causes Alzheimer's disease, but what is known about Alzheimer's disease is it's a progressive disease that causes severe memory loss and interferes with a person's ability to perform normal daily functions. So it's a neurodegenerative disease, meaning that there's death to the brain cells that occurs over time, and that makes the actual size of the brain itself shrink, and it causes those cells to die and lose connection with other cells. It's much like a water hose. When you turn a water hose on and you kink the hose, the water isn't able to run where it's supposed to run. And instead it gets stopped in the hose and the flow stops. In the same way, plaques form in the cells, causing tangles to produce in those dying cells, and it blocks the transmission of information from getting to where it needs to go. There's 7 stages of Alzheimer's disease, and not all patients will go through those 7 stages. Stage 1 is the least involved and increases in the severity of symptoms as the stages advance. Symptoms can include loss of short-term memory in the early stages, leading to overall memory loss, difficulty finding words to use in conversations. You might forget people's names, including family members' names that you never would have thought you would have forgotten. There's an inability that might come for you to manage your finances, so a family member might need to take those over for you. You might not be able to remember your address or phone number or steps to take in case of an emergency, so an ID bracelet might be very beneficial for you. There may be a time where you start layering your clothing, wearing multiple shirts or multiple pair of pants, or you're not dressing appropriately for the weather. You might be wearing shorts when it's snowing outside. You might have incontinence, and you also might need some assistance with your activities of daily living. That includes bathing, dressing, toileting, grooming. People diagnosed with this disease usually start to experience frequent falls and behavior changes. Some will refuse showers, stating that they've already taken a shower when they really haven't. Having a home health company come out and assess your home to see what equipment might help you and also see what help that they could provide for you. That way it just makes you as independent as possible for as long as possible, and that is our goal. You might need a home health aide to come in and help you do your showers and perform those activities of daily living. According to the National Library of Medicine, studies have proven that having occupational therapy work with Alzheimer's patients helps them to maintain more normal functioning, which increases their independence, and that also helps to relieve some stress off your caregivers. So I don't know if your family is going to be your main caregiver right now, but that'll help to kind of relieve some of the stress off of them. Eating sometimes can also become a challenge. Many Alzheimer's patients feel like they've already eaten, so a lot of times they'll refuse meals. Many people with Alzheimer's will experience weight loss and require a nutritional supplement to help maintain a stable weight. So we are going to do a referral to a dietitian. That way you can do a consultation with them. That way they would be able to help you develop a meal plan that's specialized to fit your needs. A referral to a speech therapist is also going to be made for you, and they'll be able to evaluate your ability to swallow towards the latter stages that can sometimes become a problem with people with Alzheimer's. And this would help them determine what diet would be best for you. Your speech may also be affected. Some patients revert back to their childhood. They start talking about their parents who have been deceased for many years, but speak of them as if they're still alive now. So if that happens, that's something that's completely normal for this disease. Some people begin to wonder and will require a locked facility. That's not saying that all these things will happen to you. These are things just to know that if they do happen, they are normal. According to managed healthcare, the approach of the caregiver has a tremendous effect on the behavior of the patient. Any caregiver that is caring for you will need to remember that redirection is going to be key in helping you during the progressive stage of this disease. Sometimes this can be a difficult thing for families to remember because this diagnosis is a difficult one to accept. So many times families tend to want to try to reorient you instead of just redirect you. And this just causes you to become angry and anxious, and they just really need to remember to redirect you. Family members are encouraged to attend a caregiver support group. This will give them the opportunity to connect with other family members who are going through the same thing that they're going through. When patients are first diagnosed with Alzheimer's, they may be started on Aricept. Now, Aricept is used for all stages of Alzheimer's, and it can be taken from 5 milligrams to 10 milligrams daily. Usually mild to moderate Alzheimer's is what the 5 to 10 milligrams is used for, and 10 to 20 milligrams daily is used for moderate to severe Alzheimer's. The National Center for Biotechnology Information reports that studies have shown that Aricept is effective and safe in treating African Americans with mild to moderate Alzheimer's disease, so it will be safe for you to take. For moderate to severe Alzheimer's, Namenda can be given. Namenda's initial dose is 5 milligrams daily, and this dose can be increased in 5 milligram increments to reach a maximum dose of 10 milligrams twice a day. We will check your renal function. If you do have any kind of renal impairment, which is kidney impairment, we'll change that dose to 5 milligrams twice daily. Okay. And with that, we just do a minimum of 1 week of treatment with the previous dose so that we can make sure that everything's going good with that dose, okay, before it's increased any higher. Okay. There's also a new drug that's out right now called Numeric, and it's actually a combination of both the Aricept and the Namenda. And the recommended dose for that is 28 milligrams / 10 milligrams daily. Now, the Journal of Neurology did a study showing that African Americans tend to also have Lewy bodies. It's just a different form of dementia and blood vessel diseases. So due to this finding, your doctor may also want to start you on some blood pressure medications as well as these dementia medications. None of these medications will cure Alzheimer's disease, as there's not a cure for Alzheimer's, but these medications are intended to slow the progression of the disease. I recommend that if you have a voodoo leader or another religious figure that you would like to contact for spiritual support, that you do so.
Okay.
Do you have any questions?
No.